And with that, it's my pleasure to introduce Anna. Anna is an employment counselor and self-advocate. She provides planning assistance in achieving and maintaining employment by connecting people to community resources, providing career exploration, and counseling services. She is dedicated to assisting people with disabilities in achieving their personal and professional goals. Anna holds a master's in science in rehabilitation psychology from UW-Madison. Anna gained experience in counseling and developed an extensive knowledge in community resources. And she interned at several local nonprofits, including Chrysalis and Community Living Alliance. Her passion for disability advocacy led to her position on the board of directors at Disability Pride Madison. And in her free time, she enjoys volunteering and volunteering in the community, and is currently serving as the co-vice chair on the City of Madison's Commission on People with Disabilities. So Anna is going to use the rest of the time today to discuss her experiences with healthcare transition as a person with complex medical and healthcare needs. She'll discuss her transition experience as she moved from a family setting to her independent living and managing her own healthcare, and it highlights some of the successes and challenges she's had along the way. So with that, Anna, I'm going to turn the presentation over to you.
Thank you so much, Maya. Can you still hear me okay?
I can hear you wonderfully.
Okay. Perfect. So I really appreciate the invitation today. I am going to share with you a little bit about myself, my history, and how I approach some of the challenges involved in managing healthcare and day-to-day support needs that I have. Let's go to the next slide. So I am originally from a small town in Illinois, about 20 minutes southwest of Rockford. I lived there for the first couple decades of my life with a brother. His name is Joel, and my mom, who was very involved in our care and day-to-day needs. My brother Joel also has a disability. We were both born with, it's called spinal muscular atrophy. It's a form of muscular dystrophy. So we grew up really as that was our reality, being wheelchair users from a very early age and kind of engaging in the world from that perspective. I grew up always with a very ambitious mindset and having high goals for myself, with a lot of diverse ideas about what my future would look like, but it always entailed that I would eventually live on my own and have a job. So eventually I went to college. I got my degree in psychology, and then as that was nearing the end, I started anticipating the next phase of my life and decided to get a master's at UW, which caused me to decide to move to Madison. So I for the first time when I was 24, 25, I moved away from my family and had an apartment. I lived there alone, and I had a 24-hour support staff that would rotate through with nurses that I would interview, hire, and train and manage the schedule myself. Like I said before, I've always had kind of big ideas and kind of thinking outside the box about my life and future. And I think that it's important to be able to look at things from different perspectives. And I found this video a while back that I thought really encapsulates how someone who's growing up can look at life a little bit differently and see how their unique experience can influence the world in a positive way. Okay. I apologize. I don't know why the video wasn't working and then the audio seemed like it was getting complicated also. So maybe we'll just skip ahead from that part of it. But essentially what the point I was hoping Steve's video would illustrate is that there's not just one way to approach life, that sometimes when we're growing up, we're told that, the point of life is just to grow up, get a decent job, save some money, kind of live inside the lines, take some nice vacations, and exist in the world that's around us. But what he goes on to say is that there's another way to look at things, that you can actually approach life looking to improve what already exists and build something that's unique that other people can enjoy as well. And so I feel like that's kind of something I've learned over the years, and being in a position where I grew up having a lot of doctor's appointments and being told different things about what my future is going to look like, what I should prepare for, and still wanting to aspire to make a contribution to the world. Sometimes it can be challenging to connect the two. So let's move forward. So like I said before, I have always had this sort of resolve that eventually I would live on my own and have a meaningful type of job. And this is probably a result of the fact that although I grew up with a lot of supportive people, I had great doctors, The message was not always that I would be a productive member of society. However, I did have the good fortune to have a mother who was extremely dedicated and always just very persistent to the idea that I would contribute, that I had skills and abilities that are unique, that are needed in the world, and that I would never be permitted to just exist and focus on just myself, that whether I was volunteering or working in paid employment, she always had the expectation that I would be contributing in some way. So I think that had a big impact on my own expectation for myself. So let's just give this one more attempt. I have one more video to share and see how this goes.
Okay, we're here in life class again after last night, knowing when you know better, you do better. We're ready to move on to what I think is another powerful lesson that I started to get when I was a really young girl, having been raised by my grandmother, and then at 6 years old being separated from my grandmother, being moved to Milwaukee and suddenly in a foreign environment for myself. I remember walking into that new space and recognizing that in many ways I was alone, which is a terrible feeling if you're 6 years old. But I have always had the deep understanding for myself that if anything was going to move forward in my life, that I was going to have to be responsible for making that happen. And I know that to be true now and can articulate it as you are responsible for your life. And if you're sitting around waiting on somebody to save you, to fix you, to even help you, you are wasting your time, because only you have the power to take responsibility to move your life forward. And the sooner you get that, the sooner your life gets into gear. This is what I know from doing 25 years and thousands of interviews on the Oprah Show. It does not matter where you come from. I have seen people come out of the desert, walk across the desert, being born in the most dire of circumstances. Doesn't matter what your mama did, whether she did or had a PhD or no D. What matters is now, this moment, and your willingness to see this moment for what it is, accept it, forgive the past, take responsibility, and move forward.
So just to kind of tie that all together, I love the way that she talks about the ability for each of us to take responsibility for our future, for everything that we have to offer, and making a decision for how best to move forward. I think that's kind of, maybe some people would consider it a contradiction, but I'm a very independent-minded person who also depends on a lot of factors in order for the independence to be realized. And I decided that I was going to move to Wisconsin to get my master's, to live on my own. And I knew that a lot of factors would need to be resolved in order to make that happen. I needed to find an address, apply for services, find individual providers, interview, hire, put together a schedule. All of these elements are kind of building on one another in order for me to move forward and live my life. And that is all aside from my day-to-day, like healthcare needs, making sure that I'm staying healthy, doing whatever I can to avoid getting a cold, preventative measures like taking my vitamins, getting enough rest, like all of that is a lot to manage as well, and takes a lot of time and energy. And then to add on that, I also try to, I went to school, I found a job. So all of those things are elements of my life. Okay. So, like it says here, again, I need a number of pieces to come together. I need to have the right people with the right types of skills and values, priorities that align with what I need and where I'm at in my life, and also finding and having equipment. For instance, when I moved to Madison, I was looking to have a home health equipment provider, and I approached one vendor company, and they said that they could not serve me as a client because I didn't use the type of equipment that they require all of their clients to use. So everyone who uses their services is required to use the one type of ventilator equipment that they provide. And because I had a type of ventilator equipment that they did not have, or that was different from that one ventilator, then they said, no, we can't serve your needs because we streamline our services and we only deal with this one machine. So navigating all of that, all of the rules and complexities that comes with having complex healthcare needs and finding a company that will serve what I need is another complicated part of independence for me. And I do have a talented group of people that support me every day. I have a team of nurses who come into my home and help me every day with where I'm at and what I need to do, helping me execute my plans, from just getting up and getting nutrition and getting ready for the day and my breathing treatment in the morning, to getting to work and getting accomplished what I'm setting out to do that day. So that's one element of my team. However, that's not the end of where my support team is. I have a great team of doctors who I communicate with and keep them updated in between appointments. I have a specialist that I go to in Chicago every year, and then I email back and forth with her as things are coming up, or just to let her know what's going on. I can say when I was younger, growing up, as part of my disability and diagnosis, I would have more issues with respiratory infections. So that's always been a major concern for me and my brother. Just the fragile nature of our respiratory system. We do whatever we can to avoid getting a common cold, because the typical cold can be more extreme for us and take longer to combat and get through. And in addition to that, can be much more intense along the way. So growing up, I was pretty routine in visiting doctors and finding out what's the latest thing and what's the newest type of ventilator and machine. And so sometimes I was interacting with doctors more than like I was at school. So I think that the interactions that I had were also very impactful. And I would say for any physician or medical professional, that it is essential to not only tend to what may need to be healed or mended in someone, but also be addressing what potential lies in that person and envision this person interacting in the world and how different treatments can serve their ability to move forward and achieve. because everyone needs to have a little bit of hope in their life, needs to know that there's a possibility of achieving, of moving forward. And I think that one thing we dealt with a lot early on was doctors and other medical professionals who wanted to make sure that we had a firm grip on reality and understanding that we understood the diagnosis and what was potentially in our future, but would primarily talk about worst case scenarios and really confronting our understanding of what's life going to look like, but really only focusing on what the worst possibility would be. And I would encourage people to kind of give both sides maybe a range of possibilities while really highlighting the strengths and potential in someone, because facing that grim reality on a day-to-day basis, it can be a challenge to consider what possibilities might lie in the future. Okay. So one last just anecdote. This is a young woman that I met a little over 10 years ago. I met her. Her name is Annie at MDA summer camp, and she was a fellow camper. And at the time, I was attending community college and kind of dreaming of the day, the possibility that I would eventually move out on my own, have a job, kind of run my day independently from my family. However, I didn't know many people who actually did that. A lot of people that I know from attending summer camp lived and still live with their families mostly, and many of whom don't have jobs and have really stayed close to home for a variety of reasons, which are all very real. But Annie was at camp, and she even spoke one day about living downtown Chicago, and she eventually went to grad school, and she was so vibrant and determined, and I just remember being blown away by her spirit and just the impact it had on me, that like my vision for the future wasn't so unbelievable. Like it might actually be a real possibility, and the fact that she was out there living it before I was at that point in my life was such a huge thing for me and had a serious impact on the path that I was on and down the road. And she has since passed away a few years ago from health complications that she experienced. But I really think she is an important lesson for really anyone, because she had these firm goals and beliefs. And even though she and I mean, I knew her, we were acquaintances, we had a lot of friends in common, and I would see her once or twice a year, and we would catch up about, you know, what specialist are you seeing right now, and what did you think of him or her? And we would catch up on things, but we really weren't best friends or anything like that. But really the deep impact that she had on me, just living by example, has lasted and continues to have a major impact. So I feel like for people who are living and navigating the world with a disability or other complex health diagnosis, just to keep in mind that even though they might not be aware of it, their life may be really profoundly impacting others along the way. Okay. And lastly, I just really love this quote and think that it's up to you to define your own brand of leadership and your own version of success. That's so true for all of us and really empowering for making decisions that can lead us all forward in our lives. So, thank you.
Thank you very much, Anna. I appreciate you sharing your story, and I think many people on the call as well. Are there any questions from the audience for Anna?
Hi, this is Meg. My question for Anna is, how long did it take for you to schedule or to set up all of your services once you moved to Madison? Do you remember?
Yeah, I remember all too well. Moved in April of 2011. I had an apartment, and I was really fortunate at the time. I had a cousin who is a nurse and was kind of in a transition in her life at that time. And so she was looking for a new job, and I kind of talked to her about the fact that I wanted to move to Wisconsin and I needed a nurse case manager, and was very concerned about the prospect of leaving my family, being surrounded by people that I was not yet familiar with, and just really wanting someone around on a fairly regular basis who I know has my best interest. So she agreed to work on my team for a while. And when I moved, I had her and like 3 other nurses already hired. But then right after I moved, I think 1 or 2 of them left. I think one had a unexpected family thing come up, and so suddenly my team was very small. That was pretty scary. So I ended up going back and forth home on like every other weekend for quite a while until I was able to recruit more people. And I remember it was almost exactly 2 years that I felt like my team was built up enough with enough people that I had some cushion and stability to feel like established.
Well, this is Meg. Then I have another question if I can. So when you moved from Illinois to Wisconsin, then did your insurance change? Did you move from Illinois Medicaid to Wisconsin Medicaid? How did that work?
Yes. Yes, they are very different. So that's a pretty in-depth process. But yeah, that was one of the first important steps. I think I needed a Wisconsin address in order to apply for services initially, and then once I was approved and I got the health card and my Wisconsin ID and kind of went step by step from there.
As you were sharing your story about interacting with physicians and how those interactions were very impactful at a young age, the discussions that doctors were having with you, typically as a young individual, you have your parent in the room, you have, they are there to ask questions, to be the person to communicate with the doctor. But at what point did you start to take control of those visits? And were you the one that asked for that control, or did the physician start to talk to you more than to your parents? Could you speak towards that experience?
Yeah. I'm over 30, and my mom is still present at many of my specialist appointments, probably not for like basic, primary care provider appointments, but for like yearly checkups with specialists. She's there, and we all have kind of, she's very like proactive. So sometimes we'll have made like a list of questions ahead of time, or things that we've heard about that we're like, let's make sure to ask the doctor about that while we're there, or sometimes follow up later. So we really taking kind of a team approach to all things in my family. A lot of times my brother and I and my mom are all in the room for the same appointment, especially for like those types of visits, not necessarily for like, basic physicals and that sort of thing. But when we're making the trip downtown Chicago. Yeah, we're kind of all in the room. Like, we always joke about we travel with a posse. So there's like all of us, and sometimes I actually usually I have my dog with me as well. So it's kind of a mob situation. But yeah, I'd say I remember when we were preparing for back surgery. I was 17, and it was the summer before my senior year of high school. And my brother and I both had surgery that summer, and we actually did it 3 days apart. And so it was kind of like, you know, all just get it done. Just get it done all at once. But like leading up to that surgery, I mean, it was like a couple of years of planning and appointments. And my brother and I remember preparing for surgery. We grilled the surgeon on several appointments, like asking him every possible scenario of everything that we could think of that was going to go wrong, or complications, or what was the best prognosis after surgery, or whatever we could think of, really looking at this from every angle. Even asking him, like, you know, is there a possibility that the surgery is going to be prehistoric in a couple of years? Like, is this even going to be necessary? Is there going to be some big advancement soon that we should know about that is going to make this whole thing stupid? So I know that we gave him a mental workout a couple of times and really like took this seriously and told him, like, okay, so we get into the OR, then what's gonna happen? And then what's gonna happen? And then what are you gonna do? So like, yeah, I'd say we definitely, each of us, my brother and I, and our mom, have our kind of particular area and concern and ideas, and kind of all bring that to the table at appointments.
All the lines are open. Are there any additional questions for Anna?
This is Betsy from Milwaukee, and I just wanted to say thank you, Anna, for sharing your story. I'm just wondering, and I agree with you, a lot of times when you go to specialists, the parents are in the room. But would you think that when you were younger, obviously now that you're older, but in the very beginning, do you think that they directed their conversation to you? Or if your parents were still in the room, your mom, was it directed the conversation more to your mom?
It really depends on the provider, because I know I've interacted with some doctors who have sort of intentionally been like, okay, mom, yes, thank you. Now I'm going to talk to Anna. But others are not always that way. I don't really have a particular feeling about it. So I'd say it really is, it kind of goes across the spectrum for me. But anytime that someone's in that type of dynamic so much, visiting hospitals, at doctor's appointments, I think at least I developed a certain comfort level in the hospital setting that, I mean, okay, I was little. My brother got pneumonia 14 times before he was 6 years old and was hospitalized for each of those. And so I don't know what his problem was, but I didn't get pneumonia that much. And so I was always kind of carted with them. We'd take the ambulance, and I just thought it was the funnest thing in the world. And then we'd go to the hospital, and I'd see all my nurse friends, and they would take me to the nurse's lounge, and I'd have cake. And meanwhile, my brother was like coding down the hall, and I had no idea. I just thought I was having a ball. So I got very comfortable in the hospital. I thought it was like my playground, and that kind of helped me be comfortable in appointments and talking to nurses and doctors and asking questions. And sometimes I think I'm almost more comfortable sometimes in that role of like spunky, combative patient than like, professional. So I think that that's a challenge for me, to not fall into that comfort of like, this is where I belong, the hospital. This is my place. This is where I feel most myself. I mean, that's not a healthy thing. So for providers, I would encourage to always be inquisitive and asking about life outside the hospital, hope for the future, ideas for the future. What are your interests outside of the hospital? Because it's not a good thing for any young person to only see themselves in that context.
I think that's a perfect spot to end. That's a great way to finish off this presentation. I want to thank you for joining us and sharing your story and your unique experiences. And I think that everyone who was part of this learning community got a great presentation today. So thank you for joining us.
Thank you.